Hey guys, it's Dr. Emer, and we are doing one of my favorite treatments today on filler night is lip filler. And I love doing it because the work that I tend to do is more subtle, more natural, not too overdone, and it gives just that little bit of pep to the face. It just makes it pop a little bit more. And I have my beautiful patient today, okay, you can take the ice pack down, who's been icing. And she has great lip shape. She just wants them to feel a little more plump and a little more shape. So all I want to do is just even it out. You guys can see the lower part of her pillow of her upper lip here is a little more lower on that side than this side. And then I just want to always keep the balance. We're going to do a little injection. Always keep the balance of the lower lip being just a little bit bigger than the upper. And so with her, I really just want just a subtle amount. I'm just going to do very little threads. We're doing Juvederm Vollure, and because it's going to give her that pout that she's looking for. I also really like that her middle lip has a little bit of a cleavage, so we're going to leave that cleavage. Okay, we're going to do that same thing in the upper now. We're just going to go right into the Cupid's bow and just give a very small, subtle bit. Getting a nice lift. And same thing in the pillow.
True or false? All lips are the same.
Definitely not. Okay, you guys, the key, and this is the thing here, deep breath in, breathe all the way out, perfect, is that they're not the same, and you really want to tailor the treatment to what it is she's looking for. So with her, we really just want to balance the shape a little bit. Beautiful. Okay, ice again, hold on. Okay, ice again.
Now tell us why the Cupid's bow is very important, and you have to be very careful with that.
The Cupid's bow is so important, you guys. Not only does it create the shape of the beautiful lip, but also you can damage the look of the face if you don't do the Cupid's bow correctly. Okay, take that down. We want to keep her lip nice and shaped. Now, it always looks bigger at first, you guys, just so you know. We're doing a pillar technique. And the thing is, everyone always, the first times they get lip fillers, they kind of freak out when they first see it. Then they go home, and about 2 days later, they're like, oh, I wish it stayed that same way that it did the day of injection. So now we're going to do that same thing here. We're going to go right up into the Cupid's bow. Just give a little bit for a lift. And we're going to come up in the pillar technique. And then I also want to, again, okay, now I want you to ice again so I can take a look. We just let the swelling kind of come down a little bit. We take a look. We may not use the whole syringe. I'm going to do a little bit around. Let me come on this side actually now. So show you guys. Okay, take that down a sec. Great. And then a couple things you want to do is always do a little bit right on the edge, just to keep the lip corner up and shaped. Right a little there. I still want to give a little more definition right here on the edge. Okay, on the other side, hold on.
How come you always go for the natural look and not the Kylie Jenner look?
Well, because that's my look. That's how I do it. I like it more subtle and natural. Some people like it a little more defined and big. My patients tend to be of the patients that want it to be very subtle. So I think that's good, you know? At first, I mean, okay, ice again a second, then I'll take a look. Just trying to even out that little pillow difference she has, but it's always going to be a little asymmetric because I tell you guys, asymmetry is really nice when it comes to faces. The most beautiful faces tend to be a little asymmetric. It's okay to have a mole or a little bump or a little bit, discrepancy because it makes you a little more unique. Okay, let's take a look. Let's see. Really good.
And again, tell us what product you're using.
So this is Juvederm Vollure. I'm gonna do a little injection on the outside. This last bit, just 0.1. Just because it's a little for your mouth. This is Velour because it lasts like a year, which is why I like it, but it's also very soft. So what I want to do...
Does it hurt?
No, I mean, she did great. It's just swollen right now, but I like it. I just think that you're going to see, if you take a look right there, you see she has the keyhole pout, a little lifting on the edge, and then improvement in the pillows. I think looks great. Once the 20%...
Emer reveal?
Yeah, do an Emer reveal first. Forgot, do an Emer reveal. Now with her, I didn't do as crisp of a border because I think her softer border looks a little better.
I love it. It looks so beautiful.
Turn a little that way. I want you to see the angle. Doesn't look overdone. You still have the little lift here and a little bit of the pout there. What I like in the middle is the keyhole. You see how you have that little pout right there? Before, the one side right here dipped down more than the other, so it's going to look a little different to you at first because I brought this part down a little bit to match this, but now you have that keyhole.
I love it. This is exactly what I wanted.
So, great. I'm so excited. Let me show you on a regular mirror. How was the pain though?
Totally doable.
Not bad.
Like barely felt it at all. I'm so happy. You're the
Good.
best.
See you guys, this is so fun. This is why I love doing fillers because you can make these subtle enhancements and make people feel really good about themselves right away. Yeah, it looks amazing. And then the cool thing is long term what you can do is we could even change the filler and do something more structured at the border if we wanted. I really like the soft look. I did create a little bit of a column there, a filtral column to give her a little more lifting because her lip tends to go into the upper lip a little bit more. And then I also did, the key right here is right in the corner, to lift these corners up, using like 0.1 of product, very little, to just lift it. So we will take a look at her lips in the next 24 hours in the next week. It's gonna be great, looks beautiful. I feel so glad, first timer, and she's happy. Bye. I mean, looks awesome.
Thank you so much.